doctors, nurses, healthcare workers. Now, public health isn't something that's usually associated with climate change. So how is climate change affecting people's health?
Good question, Gregor. So people don't always immediately think about health when they consider climate change, but actually climate change has been described by many experts as one of the greatest public health threats of all time. So in answer to your question, Gregor, yes, the two are very much linked. Public health is very closely linked to climate change. The direct impacts of climate change may not necessarily be as obvious as they are in other parts of the planet, such as, where you see glaciers and ice sheets that are breaking up. But they are nonetheless very real here in the UK. The impact of climate change and global warming causes extreme weather events here in the UK, and it's these events that have an impact on our health and social well-being.
Thank you, Mustafa. So here in Wokingham specifically, how is climate change affecting people's health?
Okay, so I'll give you two examples. So in recent years, we're seeing increases in the frequency and intensity of flooding and heat waves. So in terms of heat waves, this continues to affect the health of many people who are actually already vulnerable. So we tend to see increased hospital admissions for things like heat stroke, especially among people who have clinical risk factors, so people who have long-term health conditions already. In the case of extreme flooding, the impact to water, sanitation and hygiene can also bring detriment to people's respiratory health. So we see the spread of infectious disease and also the prevalence of mental health among people who have to struggle to cope with the aftermath of natural disasters is also a big sort of impact on people's health that we see very locally here within Wokingham, as well as in the wider nation.
So I'm assuming that you and your team are working very hard to combat this. So what are the types of things that you're working on at the moment?
So we're doing sort of three things. The first is around building awareness. The second is around building resilience, and the third is around building networks, and I'll expand on each one. So in terms of building awareness, that's partly why we're here today. We're trying to convince as many people, to help encourage as many people as possible, especially our young audiences who have fresh new ideas for how we can tackle these problems in a positive way. The second thing that we're trying to do, or the second area that we're trying to impact, is building resilience. So working with other agencies of the government, such as Public Health England, to write policies that govern how our local services should respond to natural disasters. So when there's a freak spell of really cold, wintry weather, we aid the planning of how to support our vulnerable communities and identify who exactly these sort of vulnerable communities are. Are they really frail or elderly? Are they extremely young people? Or are they, people, struggling to get to school on a daily basis? The third area of work that we're trying to impact is building networks. So we're partnering with other groups and other teams to reduce activities that worsen climate change. So we'll work together with highways teams, for example, to build a mandate to reduce carbon emissions, or we'll work with local planning teams to design public spaces that encourage people to participate in more active travel. So those are three key areas that we as a public health function are trying to impact in order to address climate change and its threats.
Thank you for that, Mustafa. It's great to hear from a team that people wouldn't necessarily normally associate with climate change and listen to some of the things that they're doing. So thank you very much for that.